Hi, this is Susana Aguirre. We're going to go ahead and show you parts of the sheep heart in the external view. This is the anterior part and this is the posterior part of the sheep heart. We're going to go ahead and start here. The epicardium is the outside layer of the heart that protects the heart. Then we have the apex, which is the base of the heart here, and this is the apex. Then we go to the right atrium and the left atrium. And the right atrium receives deoxygenated blood returning to the heart from the superior and inferior vena cava. So it's here. Then we have the left atrium. The left atrium receives oxygenated blood returning to the heart from the pulmonary veins. Then we have the right ventricle and the left ventricle. Intraventricular sulcus. In this intraventricular sulcus, we do have the great cardiac vein and the anterior and interventricular artery that run through this intraventricular sulcus. Pulmonary trunk, we have the pulmonary trunk back here. In this pulmonary trunk, this is a major vessel of the human heart that originates from the right ventricle. It branches into the right and left pulmonary veins, which leads to the lungs. It carries oxygenated blood from the lungs, is circulated back into the heart through the pulmonary veins that drain into the left atrium. Then we move forward to the aorta. This is the aorta. This is the descending aorta. This is the aortic branch. And it carries three major vessels, one being the brachiocephalic artery, the left common carotid, and the left subclavian artery. This is the superior vena cava, better viewed in the posterior area. That's the superior vena cava, and it comes out through here, which is the inferior vena cava. Then we move to the coronary sinus. The coronary sinus runs along this side here. The coronary sinus carries deoxygenated blood from the heart muscles itself, and it drains into the right atrium through the coronary sinus. So, and it would be located here between the left atrium and the left ventricle, right about here. All right, so that is the external view of the heart. We're going to go ahead and move into the internal.